Hey everyone, my name is Dr. Jocelyn Connolly, pelvic floor physical therapist and founder of the Vagina Doc. And in this video, I'm going to go over ways to train your breathing in positions while in labor. So the positions that we're going to cover in this video will be supported child's pose, supported deep squat, and supported quadruped in a rock back position. Now, one of the things that I notice with people getting ready for having a baby, even in the birth classes, is they do focus on breathing, but not enough attention is placed on how to maximize your breath, both on the inhale and the exhale. So when you inhale, you want to make sure that you're getting expansion throughout your ribs and that there is a dropping or a bulging in your pelvic floor. What I often see is that people keep their shoulders elevated, or when they breathe, they are moving their shoulders and there's a lot of movement up here and not enough down here, which results in the pelvic floor actually staying where it is or actually shortening. So what that can do is that can pull the baby back up when you inhale, essentially making it harder, or like say you progress, but then you're just like, you take 2 steps forward and then you take a step backwards, or more than just a step. So when you breathe and get that expansion, then you're more likely to get the dropping of the pelvic floor. But when you can combine the two of those, then you really can make progress. And then you can also get progress, obviously, with the pushing and with your exhale. So even if your contractions are present or not, this is a way to continue to progress through labor just by breathing. What you'll need is a space on the floor or a surface. You'll need bolsters or props to support your abdomen, and then something like a med ball or like a stool that you could sit on in a deep squat position. In this video, I don't have something to hold on to, but it's also ideal in one of the positions, the deep squat, to have your hands supported versus just being in a, just sitting on the ball. First position we're gonna cover is supported child's pose. And I'm gonna demonstrate the breathing upright so you can see it. And what you're gonna do is you're gonna get into the position. The props, I have 3 different props, a blanket and 2 pillows. Props are gonna support my abdomen. Right now I'm not pregnant, but if I were, I want to be able to have some support to my abdomen versus it just hanging, because that could add tension to the lower back, which could create more guarding. And you're gonna inhale, rib cage expands as much as you can, back of the ribs, front of the ribs, belly expands if it can, and you are simultaneously dropping or bulging your pelvic floor as if, you know, you're trying to create space. If, let's say, you know, if you had a tampon in, you were trying to get the tampon out without pulling it out. But you're not necessarily pushing, because when I say push, people tend to tighten and shorten their abdominals versus dropping and bulging. I don't know, the psychology just tends to work with a lot of people. But if you have to think push and you don't get that contraction here, that's fine. You're gonna breathe in and let your pelvic floor drop, and then you can either exhale regularly, or you can exhale like this, where you say your belly is already expanded with air, and you're gonna keep your belly expanded as you exhale just by a normal exhale. Or you can create a sound effect. Shh. And I did a shushing motion there, but you could do whatever. You could do it with a K, like a whatever works for you. And then the intervals, which I typically recommend practicing that, is either 30 seconds to 60 seconds, all the way up to 2 minutes if you're conditioned for that. And you can either continuously do that cycle, like you just do back, breathe in, breathe out, or you could reset in between, because your exhale is going to be pretty short. You could, and sometimes just people could get lightheaded or out of breath or whatever. So do what feels comfortable for you. And not too comfortable, because if it's too comfortable, you might be reverting back to your default. So supported child's pose is just like this. You let your belly relax. You have support from the pillows to let your abdomen relax, your low back be relaxed. And you just go back and forth between the inhale and that bulge, and then the exhale, making the belly big or regular. Second position, I'm just gonna go over it because I'm in the position, is the supported quadruped. Now the difference between this is you're on your hands versus being relaxed there. Pillows are still gonna be placed so that your belly is supported and you can let go. You're gonna have to play around with the pillows so that it's enough that your back isn't too falling down as you relax your abdomen. You want that support to keep your spine in neutral. And same idea, you're gonna breathe in, expand through your ribs, try to bulge your pelvic floor. Exhale, make your belly big. Now, I didn't mention this before, but you will not, if you're opting for the option of exhaling and making your belly big or whatever sound effect, that could be too much strain on your pelvic floor immediately, especially if your pelvic floor or layers of your pelvic floor are sitting low. So in that case, if you do have perineal support, it's a good idea to wear it during this. That's also good feedback. And then you may want to start off with alternating or doing one of those exhales, making your belly big, every 5 breaths, or do a couple within one interval versus doing it every time and then working your way up. So again, this is the position for the supported quadrupeds sitting back. Third position is the deep squat. And again, I want to remind you that if you can set your med ball up that you have something to hold on to, you don't have to, but maybe a good counter support, especially if that's what the setup is wherever you're birthing. And the thing that I like about the ball is it provides feedback on your perineum to drop into as you are breathing in. In this one, you don't really need as much. You may not need your perineal supportive wear because you have the counter pressure from the ball. And that same idea, you're breathing in, pelvic floor drops, trying to connect with the ball with the dropping. Either exhale regularly or exhale and do the shh, or whatever sound effect that works for you. As you go into that exhale, keep in mind, if you are forcing anything, you may be adding a arch into your lower back, so watch out for that. You want to keep your spine in the same position the whole time. That's it for this video. I covered the basics of breathing, both on the inhale and the exhale, and provided 3 different positions that you can practice that in. Everyone's going to be different with what's comfortable and how far they go back with your hips, so just play around with it. You want to make sure that you can fully sink into the position. If your hips are uncomfortable, you may need to increase support, decrease the range of motion, or increase the range of motion depending on your body and how much joint motion you have available, and also just general flexibility of the muscle tissues. Ease your way in. Usually I recommend 2 to 3 rounds of 30 to 60 seconds, and then progressing either by decreasing the reset breaths or increasing the active exhales with the continuous elongation of your pelvic floor. If you have any questions, please post them below. Otherwise, if you know anyone that could benefit from watching, please share. If you're not already subscribed, be sure to subscribe so you're notified every time a new video is dropped. Thank you so much for watching.